Hi folks, it is May 1st as I tape this. It is a new day in Cobb County and really for the state of Georgia because the governor has lifted the shelter-in-place order for most of us, all except for the elderly and medically fragile. So, does that mean we should all run out and resume our daily routine? I had a chance, as I try to do every week, to talk to Dr. Janet Memark. She's the director of Cobb Douglas Public Health. Her message is, not so fast.
So I really hope that that doesn't happen because our citizens have done such a great job in sheltering in place, and I believe that was the single most important thing that we've done to keep the hospitals from being flooded and having even more deaths than we do right now. So as you go back out into society, remember that the virus is not gone. You know, as we test here at Jim Miller Park, we still are getting about 8% that are positive. So that means that, you know, out in society, we probably have at least 8% of people that have it. And so remember, when you go out, it's not gone. So act like it's there. So make sure you wash your hands, make sure you social distance, make sure you wear your face mask around people. These are really important measures that we put in place, and stay home if you are feeling sick. I know we're used to being tough and going and working, but please stay home if you feel ill.
So still be cautious and be safe is what Dr. Memark says. A lot of the questions we're getting here at the county is what about our parks? We have 90 parks facilities throughout the county. Most of those are outdoor facilities. Are they all going to be reopened? Well, the county manager is working with district commissioners to determine the status of each of those parks, which ones can be opened fairly quickly, which ones will take more work to get reopened. They're working on that right now, so expect a gradual reopening of our parks facilities moving forward. Our outdoor park facilities, our indoor facilities likely will stay closed as long as the public health emergency exists. And again, the concern is all about the COVID-19 virus, and Dr. Memark says when it comes to that, medical experts now have more symptoms on the table to deal with.
It's a recognition now that a lot of the symptoms that people were experiencing have been validated to be consistent with COVID-19. So it's very important that we can acknowledge that these are symptoms of COVID-19. So it broadens the criteria as well. So now we have 6 new symptoms I will tell you about. So it's having chills that you can have and sustained chills with fever. You can have muscle aches now. You can have a loss of taste and smell, and that has to be new though. You can get that, and then sore throat and headaches are now added. So a lot of people, I know it can be confusing, but that a lot of people can be having these symptoms, and we often have them, you know, in daily life. But because we do have COVID-19 in our community, it's important to recognize these, and then you can get tested if you have these symptoms. So any of these symptoms, we can go ahead and test you along with the fevers, cough, and shortness of breath. We can do that as well. So if you have those symptoms, but remember that people without symptoms can also get tested. So the people that have that are healthcare workers, frontline public safety workers, critical infrastructure workers, and people who work in nursing homes or live in nursing homes, you don't have to have any symptoms to get tested. And so we encourage people who have had a lot of exposure and contact to go ahead and get tested, especially as we go to reopen society.
So again, those symptoms are rather broad and unique to many of us. I mean, we all get headaches or sore throats every once in a while. So if I have one of those symptoms, do I really need to get tested? Well, the short answer is yes.
Well, you know, of course you don't have to get tested, but so I'll give you an example. In our nursing home settings, we have a lot of asymptomatic spread that's happening, and this has been recognized in the last few months, and that's a concern. So if you don't know that you have symptoms, you can be spreading it around and not know. So unknowingly spreading it and unknowingly spread it to our elderly and vulnerable population. So I think it's important that we do some testing so that we'll know if you have it asymptomatically and that you continue to be cautious. But remember, you should always be cautious. So remember, always washing your hands and wearing your face mask, and really try not to go out too often unless you have to.
And speaking of that testing, I don't know if you've seen anybody actually get it, but the initial testing is rather, let's just say, invasive. Involves sticking a swab way up your nose. Dr. Memark says they're now using a new test that's not quite as invasive.
Yeah, so testing is a little different as well. So Previously, we only had a few ways to test, and one of those was what you've heard of, the nasopharyngeal swab. So it's that swab that goes all the way into your nose and really goes to the back of your throat. It can be uncomfortable. Now, the CDC has brought in ways that we can test, so we will continue to do that, but you can also do a nasal swab just inside your nose, and then you can do the back of your throat. So I didn't want people to be concerned if people were doing different ways, because that just changed within the last couple of days.
So as you may be able to see and even hear behind me, a lot of folks are getting back out again and trying to resume at least a modicum of their daily routine, which you can do, Dr. Memark says, only with precautions, because we are in this new normal.
For at least the next year, this is going to be what life looks like now, so that we have to know that there is an invisible virus in the air, and we have to do everything we can to protect ourselves and our loved ones from it.
The medical experts all agree that it's all about testing. Testing can tell them how much COVID-19 is in our communities. And the big story in the first several months of this pandemic has been really the lack of available testing, not only here in Cobb County, but really across the United States. That's all beginning to change. More testing is becoming available. They're doing 300 plus a day down at Jim R. Miller Park right now. And that means the Public Health Department is now actually reaching out to certain groups to encourage them to come in and get tested.
So right now, we are reaching out to a lot of our community and in Cobb County government, and having our public safety officers also tested. And so right now they're doing over 300 a day at this location alone. So that's great. So that's picking up. And I want to remind people, through Cobb Douglas Public Health, you do not need to have your doctor put a referral in. I just want to make sure people understood. You go online onto www.cdphcovid19testing.org. You'll put in your own referral, and then that will be kicked over to our nurses, who will send you an appointment and put you into our system. And so the expanded role nurses that we have are able to do that. So it's a very easy process. Then you'll be called and then come through at our drive-through at a designated time.
You heard Dr. Memark tell me that 8% of those that come through the Jim R. Miller Park are testing positive for COVID. That's a fairly alarming number, and shows why testing is so important and much needed still here in Cobb County. You want to try to figure out all this kind of confusing information about the governor's executive orders and the shelter in place? We've got it all on our website at cobbcounty.org, our COVID-19 page. Check it out, be informed, and be safe.